I started working with people with learning disabilities when I was 16 as part of a voluntary group, and I really enjoyed that working with young people with learning disabilities. And people with learning disabilities have always been part of my life. They've been part of my family growing up. So I had an awareness of people with learning disabilities. And when I was coming up to leaving school, I was not sure whether I wanted to be an archaeologist or a nurse. And this work that I was doing voluntary kind of nailed it down for me, because I repeated a year in school so I could take on a science subject, to take on biology, so that I would have the right qualifications to get on to do nursing. And I started my training in Cork as a registered nurse learning disabilities. So it was a 3-year programme. I won't say what year. It was a fantastic programme. It was the breadth of everything that you could possibly manage in nursing, in terms of paediatric nursing, mental health nursing, district nursing. But in terms of working with people learning disabilities, it includes hospital care, vocational training, residential care, a whole host of things. And the philosophy of where I trained at the time was that they wanted student nurses to experience the same experience that the people learning disability had, whether that was in where people lived, worked, or went to school. So it was a very broad opportunity, and that was over a 3-year course. And then when I finished that, I staffed for a while, and then I went to work in Australia as a registered nurse learning disabilities in a very different environment. So care in the community hadn't even happened in Australia, and it was very much hospital based and very different. I neglected to say that, of course, a key milestone in working with learning disabilities, that's where I met my husband, and he was a student nurse for learning disabilities as well, and he still works in learning disability sector. So it's been a fantastic experience. And then of course I came to England in October 1990 and worked in Cheshire, Merseyside for a long time as a community nurse, and then held some other roles around community nursing, but always held a passion for the future development of nurses and learning disabilities, and the future development of services for people with learning disabilities. Well, as I mentioned, I had experience of people with learning disabilities in my family.
Yeah.
And I think when I started doing the voluntary work, I didn't have an expectation of what it was going to be like, because there was a lot of social aspects to that voluntary work. So we would buddy up with somebody with a learning disability every week and make a commitment to visit with them, or take them out shopping, or do something that was social. And then we did a lot of fundraising. We did trips away. So I guess when I started, I didn't really have a real understanding of what that was about. But what I did do was really enjoy it, and I really enjoyed working and being with people with learning disabilities. And I got fierce gratification out of that experience, and with their families as well. So I think that started focusing my mind about, I really enjoy this, and I carried that on right up to the time I started and after started being a student nurse, because I think wanting to do archaeology was an interest that I had in school, but actually becoming a nurse was more than that, and at that time, of course, in Ireland, it was seen as very positive as a vocation, and I think things have changed a lot now in nursing. There's a vocational element, but it is a professional career, it's a very important professional career. And I guess, it's been a journey to this point where I'm at now. It's been a journey, but I guess going back, I didn't know what to expect until I tasted it a bit. And then when I started my training, because it was so diverse, there was never a dull moment. There was always something new to learn, some new experience, new experiences with different groups of staff, very multidisciplinary. Like working with the district nurses, that was fascinating. Working in mental health was fascinating, care homes, and working inside, vocational training centres and making things, like making, I'm trying to remember, I won't say baskets, but making things like tables and lampshades and lamp things with people. And that's gone back a number of years. The services in learning disabilities now are different. But by doing that work and having that broad experience really helped me have a passion to continue that work. I couldn't think of one person that sticks out because I have had a long career and there's been a lot of people and a lot of families. I guess one does come to my mind that I don't think I made the difference that I wanted to make, and it still comes in my mind, but I was a big support to the family at that time, and that was over a long period of time. And I think I can think of loads of different scenarios in different countries, and all of them are positive. They weren't all easy, and I think what's different with learning disability nursing is that you do become a really trusted member of, I won't say the family, but you do become a trusted member of that network that family has to support them. And I think that's a great privilege. And while I would say it's a privilege to be a nurse, I think being a learning disability nurse gives you that added privilege that the relationships you have tend to be more longer term than they would be in other disciplines of nursing. So I can't think of one that I want to share because there's so many and they're equally so important. And I'm sure every other learning disability nurse would say the same. But there is that long relationships that you make, and you see people going through different transitions in their life, from childhood to adulthood, and into leaving school and going into jobs, or needing support for the longest time. So. I think the key thing for me is, and I think for families, and each family, it's a person-centred approach. Each family, each individual will have their own unique needs. But I think what a learning disability nurse can bring is a certain amount of expertise in understanding that particular situation or particular condition, but also to bring advocacy and problem solving to the table for that particular individual, and to be a connector for that individual. And of course there's a whole host of other roles that a learning disability is. There also are a therapist, they're support, they're a facilitator, they a care coordinator, they navigate services for people. So the role is so broad and vast. And learning disability nurses will tell you that there's never no 2 days are the same, because you need to be flexible and to be adaptable, because you're doing different things and supporting people in different ways. But I think a key is around advocating for and with people with learning disability and their families, because we know we haven't done as well as we should do over the years, and we continue to make the same mistakes around making sure that people have a voice, that they are not discriminated, and they get access to services just like the rest of the population. So really a learning disability nurse brings all those elements to the individual and their family. I would like to think I was a good learning disability nurse. I think it's hard to measure that because that's measured by the people that you're supporting and connecting with. I think, I had positive feedback, and like I said, there was things that worked out really well, and there were things that I think, shucks, I couldn't crack that one. But it's about the next day is different, and you keep going on, and I think this is a good time to be working in learning disabilities. I'm really grateful to my chief exec for giving me the opportunity of coming back and working on in learning disability agenda, because as the executive lead for learning disabilities, I've got a fantastic opportunity now working with fantastic clinicians and healthcare and social care workers and colleagues in the ICS and commissioners to really work together around really doing what we can to make the services that we provide in Lancashire and South Cumbria services of excellence, and that's what I'm aiming for, to really go for excellent care to people with learning disabilities, with people with learning disabilities. So we've got a whole new investment coming through that really is going to help us develop our pathways for people with learning disabilities. So that means increasing our staff and workforce around multidisciplinary working in our community teams, developing our crisis team around learning disabilities, and in the future looking at developing assessment and treatment for people with learning disabilities. So it's such an exciting time, and I'm really privileged, and I feel privileged to get the opportunity to come back into learning disability work. Because I have done other things in the middle of my career, so it's really exciting, and it's an exciting time to work in learning disability services. So I would really encourage people to come and look at what we've got available. We've got an advert out to mark Learning Disability Week, and we're out to advert for a number of posts, nursing and occupational therapy, and there will be more to come. So please come and have a look, and please check us out, because it is an exciting time, and we want people that are really excited about working in learning disabilities to come with us. That's an interesting question. I don't know if I want to do that, because if you know me, you know I'm really keen around person-centeredness. And that's around the person being the most important thing, irrespective of your ability, your colour, your race, your religion. It's around the person. And we have recently done some work with Tommy Whitelaw, and he's going to help us in developing a person-centred framework. So that's setting out principles that values each individual as a unique individual. So I often get a little bit irritated, I think, about labels and labelling people, like labelling people as learning disabled, or as people with dementia, because it's a label, but they are a unique individual. I guess in terms of delivering services and working in big services, it helps us. But I think we need to sometimes really think about the language that we use. And somebody is a person, and the label is something that joins us all together, but really it doesn't define the person. And so one of the things, I'll give you an example. So somebody has somebody is autistic, rather than saying somebody has autism. Somebody has a learning disability, so the person is always there first, and we're there to facilitate mitigating those disabilities that person has, rather than defining them by their disability. I think what we can all do as a society is, and I think probably the Black Lives Matters does focus the mind about us all collectively needing to work where there is discrimination. People with learning disabilities have experienced discrimination forever. And we all together need to work on that. And this comes back to the person-centred piece around respecting each other as individuals and as persons first and foremost. And diversity is the spice of life. If we were all, and uniqueness is the spice of life. If we were all exactly the same, how boring would this world be? So I think in terms of the general population, us as a society, we need to respect diversity. We need to respect individuals. And if we could do that, and we can make a movement towards that, there's a lot of improvement we could have right across the board. Reducing discrimination would make a huge difference for people and their lives. Having opportunities to get healthcare the same as everybody else, to get their assessment of their needs the same as everybody else, not people assuming because how a person looks means that they're stereotyped about how they behave, how they think and what their future should be. So it's all our business to look at reducing discrimination and supporting and promoting individuality and people with learning disabilities and people with disabilities generally.